Welcome to the diabetes series. Today I'm going to share two specific handouts, which are basically your educational resources that I share with physicians, clinicians, healthcare professionals, as well as my patients. Now, my medical students, when they rotate with me, they get involved in these projects. So the first one is the diagnostic criteria for diabetes. Now, this is pretty much universal and good to have this, or at least be aware if you are looking at your annual screening and not sure where you fall into pre-diabetes, normal diabetes, then this would be a great one for you to have. Or if you are a physician or a clinician, great one to discuss with your patients when you are discussing blood test or even have it in your offices. Now, the second one is my favorite, is my dearest one, which I had created a long time ago, which was almost in 2007 during my diabetes project when I was doing residency. And now this is an interactive PDF where you could use a digital copy as well as a printout, whichever suits you. What does this have? It's inspired by American Diabetes Association guidelines and my clinical practice approach. It has, the identification, what kind of diabetes or pre-diabetes one is dealing with or one is treating, and then important parameters that are useful when we are looking at progress, when we are looking at follow-ups. The other aspect, if you take a look, is about blood test and what kind of evaluation are needed, as well as what form of device or diabetes technology your patient or you are using to know what your glucose levels are. It also has the most commonly prescribed class of medications, which are all listed here with columns and sections for each visit. If you flip around, what you see is other aspects like looking at liver enzymes. What is the urine microalbumin, which I've already talked about in routine blood tests needed for type 2 diabetes. It also includes sections for referrals, what kind of cardiac screening, a podiatry visit versus an ophthalmology visit. And at the end, there are certain associated conditions that can occur with pre-diabetes, type 2 diabetes, or with type 1 diabetes and are essential for screening. I usually update them as American Diabetes Association guidelines will update it every year in January, and these are from 2024. So go ahead, download these. They are available on my website, unifiedendocrinecare.com, or you can subscribe to my newsletters and follow along, subscribe to the YouTube channel as I share the wealth of information about endocrinology and lifestyle medicine. So empower yourself with the knowledge of prevention.